This woman is a unique case in that she was the only member of the fairer sex to be tried at the Nuremberg trials of the doctor killers. This is X-War history. Let's begin. Born to a family of simple working-class people, Gerta had dreamed of becoming a doctor since she was a child. Since her parents could not help in any way, the girl worked part-time to be able to pay her tuition fees at medical school. Fellow students later recalled that Gerta had a rather mean character and shallowness. In addition to this, her sadistic tendencies manifested themselves already during training. For example, Oberheusser adored conducting experiments on animals, especially with vivisection. In 1937, after receiving her diploma as a dermatologist, Gerta joined the Nazi Party and began working at the Physiological Institute in Bonn. But this was not enough for the girl. She dreamed of career advancement, so it was not surprising that in 1940, Oberheusser responded to the recruitment of doctors to the concentration camp Ravensbrück. Certainly, doctors in Ravensbrück were recruited not to treat prisoners from various illnesses, but to conduct medical experiments. Female prisoners and their children served as guinea pigs. This monstrous project was headed by Himmler's personal physician, Karl Gebhardt, who was assisted by Oberheusser, as well as his assistant Fritz Fischer, camp doctors Rolf Rosenthal and Gerhard Szydlowski. The main emphasis of the sadistic doctors was to study the body's capabilities under extreme conditions. Prisoners were especially inflicted with wounds and then tried to treat them with experimental preparations. In some test subjects, the wounds were specially treated with mud. Foreign bodies, glass, iron were put into them, and then the patient's conditions was examined and recorded. Obviously, from such experiments, the prisoners, already weakened by the terrible conditions of existence, died. Interestingly, doctors Rolf Rosenthal and Gerhard Szydlowski tried to avoid participating in inhumane experiments, so Oberheusser took over their duties with great pleasure. In general, she hoped that working together with Gebhardt would allow her to secure a career advancement and even a breakthrough in her own life. However, according to the recollections of the prisoners, Oberheusser stood at the very end of the line of the camp staff during the formation, which indicated that she had the lowest status in the camp. For example, one of the survivors of the so-called Lublin transport, Stefania Latocka, recalled how on June 22nd of 1941, 75 of the youngest and healthiest women were lined up at the camp square. Soon a short, fat SS officer with red hair and wearing medals came in. It was Karl Gebhardt. He was accompanied by Fritz Fischer, camp doctors Rolf Rosenthal and Gerhard Szydlowski, and Gerta Oberheusser. The opportunity to work with Gebhardt could have been a great breakthrough in her career, although the female prisoners standing in the square for roll call could see that Oberheusser stood on the lowest step of the medical ladder. However, Gerta Oberheusser tried her best. After the chief of the General Directorate of Imperial Security died because of an infected wound, the camp began actively researching the effects of the sulfanilamide drug, which they tried to treat prisoners with wounds specifically infected with infections and with introduced foreign bodies. The prisoners recalled how the drug was tested. Every time Karl Gebhardt approached the patients in shifts, Fischer and Oberheusser held him by the elbow, as if trying to impress him in any way. If the chief surgeon nodded, Oberheusser simply began to glow with happiness. True, the Nazi doctors failed to obtain the expected results. The use of the sulfanilamide proved to be almost zero, so by order of Himmler, these monstrous experiments were soon wrapped up, but they were replaced by others. There are many records of the treatment of imprisoned women by Oberheusser. Thus, Clara Tunke recalled that in early 1941, a transport arrived with Dutch women, mostly communists, and among them was the dentist Kvernheim, who was ill with jaundice. Clara recalled, "He asked me for painkillers because he was in a lot of pain, but unfortunately there was nothing I could do to help him." Then the young man turned to Oberheusser, and she answered, "I will give you something that will bring you some peace to your soul." Kvernheim went to the doctor's office, who, on Oberheusser's orders, administered a lethal injection, after which the body was sent to the morgue for autopsy. One of Oberheusser's favorite activities was taking blood. During such procedures, Gerta was always accompanied by a nurse, whom the prisoners called a duck for her outward resemblance. And most of all, Oberheusser adored the days when the bandages were done. Some patients were certain that she even enjoyed the disgusting smells that spread from the prisoners' wounds. Moreover, she herself had openly managed to flirt with Franz Fischer during bandaging and blood withdrawals, which amazed the inmates most of all. The aforementioned Stefania Latocka said that the lovers flirted with each other during the abuse of another patient. For instance, The woman told investigators after the war about one of such cases. To the left of the table stood Fischer. He was holding a shiny metal hook in his right hand. To the right of Fischer stood Oberheusser, and her hands were decorated with gold bracelets and rings. Another prisoner, Isabella Reck, described how she assisted Oberheusser. When Reck was called to the room, there were 5 women already on the beds. Reck was the 6th patient. Gerta noticed that some of her patients' legs were severely swollen and black. Isabella herself had her 2nd foot surgery at the time. And in Dr. Rosenthal's presence, Oberheusser took a knitting needle from the table and began tapping the bare bone with it. The woman later recounted that she was in great pain at that moment, but the saddest Oberheusser didn't care one bit. Gerta's signature was that she liked to whistle during surgeries. The eerie sound of whistling drove some of the inmates insane. Oberheusser especially so-called sang when Dr. Fischer was present during experiments and procedures. Despite her best efforts, Oberheusser made little progress. No new methods of treatment were found either. Perhaps the lack of career and professional opportunities forced Oberheusser to leave the Ravensbrück concentration camp in 1943. Her subsequent fate is rather uncertain, but there is some evidence to suggest that after Ravensbrück she spent some time in another concentration camp, Auschwitz. After the fall of the Third Reich, Oberheusser was detained and tried before the Nuremberg tribunal as a defendant in the Nazi doctor case. Despite the evidence presented to the court, Oberheusser utterly refused to admit her guilt. She first claimed that she had been forcibly sent to work in the camp, and then denied that her experiments on prisoners were a crime. On the contrary, according to Oberheusser, being placed in the experimentation rooms guaranteed the prisoners better living conditions, enhanced nutrition, and medical care. Oberheusser preferred to stay silent about the long and painful deaths of prisoners from infections and injections. Despite all the arguments of the accused, the court sentenced Gerta Oberheusser to 20 years of imprisonment. It is true, though, that after serving 6 years, the Nazi perpetrator was released and even devoted herself wholeheartedly to her favorite occupation again. She became a doctor. Whether she cured Germans or whether she again conducted some kind of experiments is no longer known. However, Oberheusser's medical career was cut short by a fateful, well, for her, accident. She was accidentally identified by one of the surviving prisoners of the Auschwitz concentration camp. Although there is no evidence of her crimes in that camp, the former inmate managed to stir up the public so much that in 1956 Gerta was deprived of her medical license, and her medical practice was completely stopped in 1958. The further fate of this woman is unknown. She lived her life quietly, trying not to draw unwanted attention to herself. Thank you for watching our video. Subscribe to X War History channel and leave a like.